If the pandemic experts have it right, the coronavirus is going to be with us for another 18 months. However, many chiropractic patients can no longer wait to go back to see their favorite chiropractic doctors. But how can you, as a chiropractic patient, effectively protect yourself while going back to see your favorite chiropractors? To answer this question, nothing beats the tried and true insight and experience and advices used by the leading doctors during this pandemic. Today, we have the great pleasure of having a true leader of the chiropractic profession, my longtime friend, Dr. David Gryfe. Dr. Gryfe is going to share his tried and true insight, experience, and advices on how you, as a chiropractic patient, effectively protect yourself while going back to see your favorite chiropractors during this pandemic. Dr. Gryfe is the chairman of the Board of Governors of the Canadian Memorial Chiropractic College, and he is the vice president of the World Spine Care Canada. And Dr. Gryfe is also a leading figure in many national and international chiropractic organizations. So he is a true leader with true insight. Without much ado, let's welcome Dr. David Gryfe to share his tried and true insight, experiences, and advices with us.
Thank you for inviting me to speak on this subject. It's an honor for myself. So I think this applies, obviously to chiropractic patients, but to people in general, in the public. Mm-hmm. And so the first thing is, take notice of how you're feeling. Are you feeling different in any way? Are you feeling any symptoms? Then take notice every morning how you're feeling. Mm-hmm. Do you have your normal energy? Do you have a sore throat? Do you have a slight cough? Are you having any trouble breathing? Mm-hmm. Have you noticed any difference in yourself? Mm-hmm. So that little scan of how you're feeling, I think is where it starts, so that you can detect any small changes that you may be experiencing, which might inspire you to look at a little bit deeper. If you want to look a little bit deeper, the Ministry of Health has a self-assessment tool. Mm-hmm. And I hope we can put that link up, because it's a very useful tool. It asks a lot of questions, but it can be done in about 5 minutes. And it really, really focuses in on those really important indicators that may lead someone to seek out a test.
Right. So this Ministry of Health is the Ministry of Health of Canada, right?
Of Ontario.
Right. Oh, Ontario. Okay, good.
Yeah. Mm-hmm. Yeah. So I'm speaking from my own perspective here as a resident of Ontario. Right. But they put an excellent tool up online.
Okay.
So if you clear all of those questions, if none of them come out in the positive, mm-hmm. you have a pretty good assurance that there's no overt indication of any infection, which mm-hmm. is good. That should give you a level of confidence, a level of just that it can lower your anxiety about it. Mm-hmm. And you can do that. It's free. You can do it every day if you want. You can just if you really want to be diligent about checking your health. That tool is infinitely available to anyone. Mm-hmm. Right. So that's nice. The province now allows you to get tested basically for any reason. Even if you are a little concerned about maybe a contact or an exposure or anything, you can get tested at many sites in Ontario. Mm-hmm. It's not a big deal to get tested, right. and we live in a country and in a province where it doesn't cost you anything to get tested, mm-hmm. and you'll get the results back within a couple of days, mm-hmm. and it'll give you another very strong level of assurance mm-hmm. that you're not a threat to the people around you. And nor are you in any danger, right, in terms of this disease.
But a lot of chiropractic patients, they really can't wait to go back to see their favorite chiropractors.
Right.
But on the other hand, they have this, the virus is hanging somewhere.
Right.
Do they need to be concerned to go back to see the doctor?
Okay. Right. Okay. So I'm getting there. And so the next step is, if you're, going into any establishment, now I see people wearing masks in cars, and I see people wearing masks when they're walking in the park, and If you want to, that's fine. But the important thing is if there's nobody around you, you're not going to spread it to someone.
Right.
But if you get into an enclosed space,
Uh-huh.
that's when the mask becomes extremely important. So any kind of enclosed space, because you may pass by someone, you may come into closer contact with someone.
Right.
And it's certainly in a chiropractic context, you are going to be in close contact with someone.
Mm-hmm.
So wear the mask when you enter so if you've been pre-screened by the clinic, I would also pre-screen the clinic. I would ask, what measures has the clinic taken to prevent spread of the virus? There should be a plexiglass barrier between the front desk and the waiting room.
Right.
There should be hand sanitizer available upon entry to the clinic. There should be spacing in the waiting room. Chairs either taken out or spaced at least 6 feet apart.
Right. Right.
So all of those measures should be taken. There should be adequate PPE available to all staff. There should be sanitizing of rooms between patient visits. So you can ask for all of those details. What exactly have you done?
Right.
If a chiropractor says, don't worry, if we adjust you, you won't get infected, run away, because that is not a good answer, right? That is not by any, there's no evidence for that. So please ensure that proper infection control is being practiced.
So make sure interview your clinic.
Yeah, sure. Yeah. Get an answer to that question. Absolutely.
Yes. Yeah.
So if you pass the pre-screening, I'm sorry, there's a
call from Chestnut Weapon.
No issue. We just wait another.
Chestnut Weapon. Call from Chestnut Weapon.
It's my sister calling, but my parents should either pick it up or okay, good. Okay, so so let's say you
We're talking interviewing the clinic.
Yeah. So now let's say you're satisfied with the measures that the clinic is taking, and you have also satisfied yourself that you're not infected. They will then pre-screen you on the phone and ask you all the same questions that you've just answered, but to make sure for their sake that you answer them, in the negative, that you haven't been out of the country, you haven't been exposed to someone out of the country, you haven't been in contact with a known case or a suspected case, you have no symptoms,
right?
You haven't had a fever, and so on. So if you satisfy each other's conditions, you can make an appointment. The appointments are very specific at this time. We don't want congestion in the office. We want spacing of patients at a reasonable time so that rooms can be sanitized between visits, so that patients do not collide at the front desk. And so appointment times are very carefully being managed at well-run offices.
This is all in the interest of the patient's health.
Yes, the patient, but everybody in the environment.
Right.
Absolutely. Yeah. So if you make an appointment, your appointment time is specific. So don't come early, don't come late. If you arrive early, just wait in your car and then go in at your appointment time.
Right.
The office will highly appreciate that because they won't have to juggle things in a way they weren't expecting. We have enough uncertainty. We don't need to add layers of uncertainty with our patients, right? We want patients to, follow a nice orderly rhythm of the office. So come in wearing a mask, and you will likely be directed into a room immediately. There won't be time spent in the waiting room. You may be asked to pay in advance. You may pay after. It's not important, but it should be a touchless system. So not cash, but a touchless system, either debit or credit, or an e-transfer, whatever you prefer can be done. But it shouldn't be, exchanging of any paper. Emailed receipts should be done, and so on. So as little interaction as possible is what's recommended, and it's the best practice. So when you come into the room, you should be able to hear the water running. The doctor should be washing their hands thoroughly. You should hear it running for at least 20 seconds.
Right.
And then the doctor will come in either gloved or not gloved, and that's not important, but wearing a mask
Yeah.
Possibly wearing specific clinic clothes, maybe a gown. And so just look for those little details that the doctor is taking this seriously and taking care to protect you.
Right.
The treatment will then go on as normal. You're both wearing masks, so you will not see the doctor's whole face, but I'm sure you'll recognize that doctor anyways.
Right.
And you'll recognize their touch, and you'll recognize their tone of voice, and you'll recognize things. And it makes it a very helpful interaction. If you're used to getting good results with chiropractic, you'll get the same good results. There shouldn't be a big change in the way that visit is being conducted. At the conclusion of the visit, you'll either have paid in advance or you'll pay after the special system. The doctor or a staff member will then sanitize the room, and you can see them. They should jump right on that immediately, and you probably see it happening.
Right.
They might start doing it even before you leave. That they're starting to get ready to do the room sanitizing.
Right.
And every surface within 2 meters of that patient, even though they're wearing a mask, properly should be sanitized with an alcohol solution or hypochlorous acid, and some other solution, some good, properly designated and approved.
So in a way that it will be desirable for the patients not to move around, freely roaming around in the office too much, because wherever they go, then you have to, all the disinfection, all this.
Exactly. Yeah. So touching as few of the surfaces as possible is what's recommended. You don't need to touch doorknobs. You don't need to touch desks, and you don't need to touch chairs, and just get on the table.
Yeah.
And let the treatment begin there, and just begin and end with that. And so, not bringing in extra bags and not bringing in extra things, that's recommended, and it's appreciated, because it just increases the amount of work that has to be done after the visit. If you're bringing in, shopping bags and other things, we have to deal with that, at least in some way, to give us the confidence back that the room is in fact clean.
The footprint.
Yeah. That's right. Yeah. So the smaller the footprint the patient leaves in the office, the better it is for everyone. Yeah.
Right.
But it shouldn't compromise the treatment in any way. Right. So whatever the patient needs, it's still a patient-centered care that we provide. Yeah.
Right.
If a patient was to develop any symptoms in 14 days of having visited the office, I would hope, and I would strongly urge them to get in touch with the office to let them know that they have developed, because we will keep a list of everybody who's been in the office, who we can contact, who was in during that period, and say, we've had someone who has now tested positive, and you were in the office during the period that they were there. And so we recommend you get tested.
But this has never happened with you.
No.
Since the pandemic, you've been opening for over 2 months, and you are taking 40 patients per day. That's lots of patients, but never happened this.
No, it hasn't happened because of good screening and because of good hygiene practices.
That's true. Yeah.
Yeah. So I think, if you put it all together, I think, it may not be perfect, but it'll be close. Right. As I've mentioned to you, I've been speaking with doctors in intensive care and asking what are they doing, because they're seeing COVID patients and they're intubating COVID patients. And I ask, what do you do to protect yourself? Because you're clearly much more on the front line of this disease. And so, the practices are not much different. If it's a normal examination, doctors are wearing procedural masks, not the N95 masks, possibly gloves, possibly a gown, not necessarily, possibly a face shield, not necessarily, and conducting an examination. If further treatment is required, if a person needs to be intubated, put on a ventilator, something like that, then all of the gear goes on to prevent, because if there's airborne drop, if there's aerosol being produced, same thing with dentists. If they're drilling in the mouth, aerosol is being produced. A much higher degree of caution has to be taken, because now you are liberating a lot of stuff into the air. With patients masked, we know that the dispersion of droplets is cut down, almost to nothing.
Yep. Mm-hmm. Yep.
Because even just a regular procedural paper mask,
Mm-hmm.
or even a cloth mask,
Mm-hmm.
will reduce the amount of droplet emission, significantly.
Mm-hmm.
And so we're not as concerned, in that kind of environment. In the chiropractic office,
Right.
People generally are not spitting and coughing and screaming and so on. It happens sometimes, but not too much. But if it's a nicely controlled environment, we're not going to be overly concerned that there are droplets everywhere.
Mm-hmm. Yep.
Right? And so that's important. So all of these things, they go into the safety and the confidence that you can have as a patient, as a doctor, as a staff member in the office. But yeah, that point about if you test positive, please get back in touch with anywhere you've been so that they can do the contact tracing that needs to be done.
Mm-hmm. 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 Yep.
Yeah.
Now, what has the chiropractic care changed before versus after the start of the pandemic? And
Yeah.
what kind of changes should the patients be prepared for?
Yeah. Okay. So the screening of patients, that was never done.
Mhm.
Obviously, we may ask what kind of problem, what kind of problem you have, and find out if we can help you before they come in. But the screening of your status in terms of infection, that's new.
Mm-hmm.
The screening at the door, the passive screening, which you'll read on the front of the door of the office before you come in and
Mhm.
answer questions
Mhm.
mentally. And then another screening level when you come into the office,
Mhm.
and maybe a temperature check on the forehead.
Mm-hmm.
And
So 4 layers of screening.
right.
by
And
office.
yeah, and then the request to hand sanitize before you go any further.
Right. Mm-hmm.
The plexiglass shield between you and the receptionist.
Mm-hmm.
All of those things are going to be new.
Mm-hmm.
The doctor appearing in scrubs and a mask is going to be different. You will only see half your doctor's face.
Mm-hmm.
So all of those things will be a bit different. But otherwise, I think at this point, now that we're 4 months into this pandemic, I think people are used to seeing others in masks and used to seeing plexiglass shields and used to seeing a lot of this, right? And used to seeing those screening questions on doors. And so it shouldn't be a completely unexpected experience for people. I think if you've been paying attention, all of these things are coming in a variety of ways. Whether you go to Home Depot, or you go to Shoppers Drug Mart, or you go to the chiropractor, or you go to see a specialist, the same messages are being portrayed. So you can expect it as a chiropractor office. If you don't see it, don't go in. If you don't see a passive screening message on the door, don't go in, because it's maybe not being taken seriously.
That's true.
And so, if you want to protect yourself, go to places that are taking it seriously until we know that it's done, until we know that all the embers have been put out.
Yeah. So what mistakes have you seen, or kind of typical mistakes have you seen that patients making when coming to the chiropractic clinic?
I would say the most common mistake is people wearing the mask improperly. I've seen people wearing it upside down so that the metal portion is under their chin rather than over their nose. I see a lot of people wearing it under their nose.
Like
So
this.
so there's no help. There's no help with that. Some people still arrive without a mask. And so, they're immediately given a mask to, if they want to come in, they'll have to wear one. And I haven't run into someone who has an objection to wearing a mask. I know there are people out there, either for some sort of superstitious reason or conspiracy-based reason or true medical reason. There are people who cannot wear masks. So far, in my experience, I haven't come into that experience at all. No one has refused to wear a mask, and no one has refused to take advice on proper use of the mask. So if someone lets the mask slip down, I will mention, that mask has to be up over your nose. It has to be under your chin. If it doesn't fit well, I'm going to give you one that's going to fit better, because that's sometimes people wear masks that are too small.
Right.
And people have different sized faces, and not every mask fits every face.
Right.
So that's important. Take a look in the mirror. Is it covering over the bridge of the nose? Is it covering under the chin? That's what a mask should do. To properly protect everyone.
Right.
And remember that if you're wearing a procedural mask, it's not protecting you, it's protecting others. If you're wearing an N95 mask or a respirator, that's protecting you. But we're not concerned so much about that. We're concerned about, if everyone's wearing a mask, then everybody is protecting everyone else. In your environment. So that's the key to it.
Great. That was very helpful.
Yeah, good. And of course, don't touch your face. Don't play with your mask. These things are so important, because as soon as you start to mess around with it, you've broken that barrier.
Right.
And now maybe you have it on, maybe you have something on your hands that you don't want to be sharing with anyone else. So we're learning a lot, and before we had this pandemic, I think we were very nonchalant for the most part with that. And you know what? To some extent, we were hearing messages from infectious disease specialists saying, don't be so clean. If you sanitize too much, your immune system will actually not get the stimulation that it requires to build up properly. That was a message that we were starting to hear from a lot of sources, a lot of good sources. Now that message has gone silent. And the message now is just protect yourself.
Great.
The precautionary principle prevails in this case.
Great. Yeah, that's very helpful. Is there anything else you would like to share with us?
Well, I think that for patients, it's really important to remember that stay-home orders do not include not getting outside.
Get your sunshine.
That unnecessary trips to go shopping for, clothes when you don't need to. Going shopping for things that are really, not so vital. You can maybe avoid that still, and maybe gradually reintroduce it, with proper precautions.
Right.
But one thing that should have been emphasized is stay home, but go out for a walk, get exercise. Whether you're doing it with online apps, or whether you're doing it in the park, or whether you're just socially distance from others and get some exercise. So if you're walking in the park or you're walking on the sidewalk, just make sure you're practicing good social distancing. If you can't, wear a mask and get out and move, because the risk of not moving is extremely serious as well.
That's true.
We know that sitting is a very potent cause of back pain. And so if you're spending all of your days, every day, sitting in front of the computer, you will start to feel it, and it won't be nice. So get up and move, and the other thing is, eat well. I know a lot of people have taken up baking, and they've taken up attempting new cooking techniques and so on, and that's great. And include lots of vegetables, and include lots of fresh produce, and make that a part of your plan to stay healthy, because we can all improve our diets. We all have weaknesses that we indulge, and while it's still okay to do that, make an effort to improve your diet during this time, because you have more time perhaps at home to do some cooking, or to do things to improve your health in that way.
Great. Thank you very much for sharing your insight and advice with us. Dr. Gryfe is a 30-year chiropractic physician and a true leader in the profession. If you want to find Dr. Gryfe, he practices in Toronto. He is at both the Humber Family Chiropractic Rehabilitation and Wellness Clinic, as well as at the Toronto Pain and Headache Clinic. So get ready to go back to see your favorite chiropractors. And if you want to see Dr. Gryfe, go to these two clinics.